Far and away the most common medical complication seen by the primary care physician after traumatic brain injury is headache. Headaches can be diffuse, they can be intermittent, they can be constant, and treating these headaches is important in the recovery of the patient. First of all, non-steroidal anti-inflammatory medications such as Tylenol, naproxen, and ibuprofen are first-line agents in the treatment of mild traumatic brain injury. Secondary agents would include the usage of narcotics, but it is important to know that we'd like to avoid the use of escalating doses of narcotics, as these can have profound behavioral effects and can impair the recovery of patients with traumatic brain injury. Dizziness and vertigo are very common medical complications related to mild traumatic brain injury. Medications for the treatment of dizziness and vertigo include agents such as meclizine or Antivert. Typical dosage is 12 to 25 milligrams BID to TID. Precautions include bladder obstruction, asthma, and glaucoma. Compazine is also effective, 5 to 10 milligrams TID to QID, being careful for bladder obstruction, asthma, and glaucoma. Phenergan is used widely as well, 12.5 to 25 milligrams PO QID, with the effects of bladder obstruction and asthma. Scopolamine or transderm patches, 1.5 milligram patches, are also effective. Once again, the complications of bladder and intestinal obstruction have been noted, but each and every one of these agents can be successfully used in the treatment and management of dizziness and vertigo following traumatic brain injury. The management of fatigue following traumatic brain injury can include pharmacologic and non-pharmacological measures. Non-pharmacological measures should include balanced diet, sleep hygiene, regular exercise, and possibly psychotherapy. Pharmacological measures may include psychostimulants, dopamine agonists, amantadine, and modafinil. Sleep disorders following traumatic brain injury are very common. These can be treated most effectively with non-pharmacologic measures such as keeping a regular sleep schedule, avoiding lengthy naps during the day, avoiding coffee, soda, and alcohol, avoiding bright lights and loud noises, and keeping a sleep log. Pharmacological measures for the treatment of sleep disturbances can include benzodiazepines, non-benzodiazepines, modafinil, and melatonin. Medications for the treatment of mild traumatic brain injury-induced nausea can include Compazine, Phenergan, and Zofran.
When you look at how common depression is after traumatic brain injury, the primary care physician should be very comfortable in prescribing an antidepressant, and one of the first-line SSRIs may be extremely helpful to help ameliorate the anxiety and depression. And they also are very helpful with post-traumatic stress disorder. There are two other medications or types of medications that may be helpful for cognitive problems. One are stimulants, such as methylphenidate, which may help things such as speed of processing and fatigue. And the other are the acetylcholinesterase inhibitors, such as donepezil, which may help with other cognitive problems, such as memory.
One needs to be careful in prescribing any medication to a patient with mild traumatic brain injury that the effects may not be the same or may cause behavioral or other secondary effects which are not seen in the general population.
The rule of thumb is that you start low and go slow, so that you start with a low dose and then you titrate slowly, and then you're very careful in terms of the use of polypharmacy. You be careful about using medications that may alter mental status and increase or cause confusion in a person with a brain injury.
Oftentimes, for instance, folks who have behavioral disturbances, they're just given a psychotic medication, an antipsychotic medication. Probably the wrong thing to do in most cases, because those medications can actually slow down your thinking, make things actually even a little worse. So we have to be careful what we're doing.